Don't give advice or make suggestions about large life matters or how a person should live his or her life. For example, change a job, move to a new city, end a relationship, etc. We should avoid offering both solicited and unsolicited advice on any area outside of our scope of practice. Giving advice may set a person up for potential failure and ourselves up for potential professional and legal problems. If what we advise or suggest does not work out, we could be liable for some financial losses, such as a client's loss of income because he took our advice or suggestion to change jobs to decrease his stress and then not be able to get a new or equally paying job. However, if what we advise or suggest does work out, the person may ask for our advice on other matters that are outside of our scope of practice. Eventually, something we advise or suggest will not work out, and both the person and his family may suffer the consequences. And how many of us have our personal lives working so well that we can tell other people how to live their lives? Avoid the words advise and advice, suggest and suggestion. We can introduce thoughts by asking questions, but we need to make sure the person understands that it is a question and not a suggestion. For example, have you considered? Or what do you think would happen if? Or what do you think are the possibilities of? I wonder how it would be if, what do you think? However, as speech-language pathologists and audiologists, we need to be very direct and clear about what we want our clients, patients, and family members to do in terms of exercises and tasks to help their speech, language, cognitive, swallowing, and hearing problems. That is, the areas that are within our scope of practice. For example, a suggestion to a child about decreasing his vocal abuses and misuses to help his voice disorder, or a suggestion to an adult with a swallowing disorder to use the chin tuck position is usually not sufficient to get the person to act. We have to be very direct when working within our scope of practice. Another don't. Don't automatically compare the patient's or family's experiences or feelings with our own. We may be living through some similar problems or have had some similar problems in our lives. For example, a child who stutters or a parent with a stroke. But do not assume that our experiences and feelings are the same as the patient's or family's. And ethically, we need to be cautious and judicious about self-disclosure, that is, saying too much about ourselves. However, we can acknowledge that we have or had something similar occur in our lives, but not that we have had the same thing or exactly the same thing as the patient or family, and that we know exactly how they feel, because we never really know how someone else feels. We are not there to commiserate with the patient or family. We are there to help them. Another don't is don't invalidate a person's thoughts, feelings, ideas, opinions, or knowledge unless it is absolutely necessary. It is very easy to invalidate someone with a but, however, or no but. This tells them that they are wrong and that what we are saying is right. It becomes the right-wrong game, and no one likes to lose that game. Another don't. When someone asks a question, don't just say, well, it depends, without providing 2 or 3 possibilities the answer might depend upon. Now, sometimes people immediately and automatically nod their heads when we say, it depends, as if they have a sudden realization of the things we are thinking that may influence our answer. We need to provide the professional information that will help them understand some of the variables that whatever they are asking about may depend upon. And much of our counseling is actually information counseling, that is, providing new information. Another don't is don't fill in the words for the person, even if you know exactly the words the person wants to say. Now, this devalues a person's communication abilities and tells the person that we can read his mind. In a way, communicate with all people the way we have learned to communicate with people who stutter. That is, let the person finish what he wants to say, even if he has long pauses.